President.
The senator from New Hampshire.
Thank you, Mr. President. I came to the floor to join my colleague and friend, Senator Murray, to say that I, too, am ready for this fight to oppose Senate Joint Resolution 13, which would allow discrimination against Title X family planning providers. This is a misguided measure that would leave millions of women and families with fewer health care options, and it would drastically decrease women's access to basic primary and preventive health services, including life-saving cancer screenings and HIV testing. And make no mistake, as Senator Murray said, the primary target of this legislation is Planned Parenthood. For years now, Republican leaders in Congress have tried to keep women from choosing Planned Parenthood as their health care provider. This at a time when Planned Parenthood serves millions of women nationwide, including nearly 12,000 women in New Hampshire, my home state, and most of the women in New Hampshire have incomes below or near the poverty line. And many of these women live in rural areas where they don't have other options for health care coverage. And the sad irony of this attack on Planned Parenthood is that study after study has shown that cutting back access to birth control and to other family planning methods actually increases the number of abortions. So I understand that opponents are interested in supporting this legislation because they think that Planned Parenthood provides abortions. But the coverage that Planned Parenthood is providing to women in New Hampshire and across this country with federal dollars does not allow for abortions. And so what we're doing is taking away women's access to contraceptives, to other family planning services, and saying, you have no choice now. More than ever, right now, facts matter. Research matters. Taking away women's access to birth control and family planning will lead to more abortions, not fewer abortions. And yet, this legislation is part and parcel of a broader national campaign against Planned Parenthood, whose clinics have been the target of vilification, of threats, and of violence. In October of last year, the Planned Parenthood clinic in Claremont, New Hampshire was vandalized not once, but twice. The second attack, a breaking and entering incident, caused extensive damage, and it forced the clinic to close for 5 weeks. I have great admiration for the courage of doctors and other healthcare providers at the Claremont Clinic. Despite threats and attacks, they're determined to continue serving women across the Connecticut River Valley, many of whom have no alternative to the Claremont Clinic. And they're typical of the dedicated healthcare professionals at Planned Parenthood clinics all across our country. Now, the good news is that, according to poll after poll, the American people across the political spectrum, from independents to libertarians to Democrats to Republicans, strongly support Planned Parenthood and oppose efforts to take away women's ability to choose Planned Parenthood as their health care provider. At last night's presidential address to Congress, I was honored to have as my guest Jennifer Frizzell of Planned Parenthood of Northern New England. Jen knows exactly what is at stake for women if President Trump and Republican leaders succeed in closing hundreds of Planned Parenthood clinics across the United States. So let's be clear, again, supporting family planning clinics is not about abortion, which by law is never funded by taxpayer dollars, something that I think is often misrepresented by some of our colleagues here in Congress. What this is about is ensuring that American women have access to the basic health care that we need. For 40% of women, their visits to a family planning center is the only care they receive annually. In 2015 alone, Title X provided basic primary and preventive health care services such as Pap tests, breast exams, birth control, and HIV testing to more than 4 million women and men at nearly 4,000 health centers. Now, I'm sure that every one of our colleagues is receiving letters and emails and phone calls from constituents on this issue. They're pleading with us not to take away their access to Planned Parenthood and the health care they trust and depend on. I received this message from Caitlin Parnell of Hampstead, New Hampshire. She said, and I quote, "As a young mother of a 2-year-old, my husband and I knew we wanted to wait to have more children. We were both working full-time but barely making ends meet. The companies we worked for offered health insurance, but they were small companies, and the monthly cost was well more than we could afford. So we went without. With no insurance, I turned to Planned Parenthood for birth control. With the sliding pay scale, I was able to get exams and birth control within my budget. We were able to decide the best time to have more children, which also allowed us to responsibly manage our finances as well. An unplanned pregnancy at that point would have destroyed the little financial stability we had. I don't know where our family would be without Planned Parenthood." And Carla Vanderhoof is a stay-at-home mother in Newfields, New Hampshire, and she wrote this, I quote, "After being diagnosed with ovarian cyst issues that caused debilitating pain, I turned to Planned Parenthood for treatment. In my case, the treatment for ovarian cysts was birth control. At the time, during my college years, I couldn't afford the cost of birth control due to my lack of insurance, but Planned Parenthood gave me birth control free of charge." And Amanda Arell of Rochester, New Hampshire sent this message. "During the ages of 22 to 25, I utilized Planned Parenthood for my annual exams and birth control. As I didn't have insurance and was in college, I was not able to afford most medical care. Planned Parenthood not only provided me with essential care, they made it very comfortable for me and were very knowledgeable and answered any questions I had. They provided birth control for me that if it wasn't for them, I would not have been able to get at a cost I could afford. I still support Planned Parenthood because they provide safe, affordable health care for all, and that is so important." End quote. Well, we need to listen to our constituents, those who are speaking out in passionate support of Planned Parenthood and other family planning clinics. As Senator Murray said so eloquently, this is about respecting women's access to health care services, including those millions of vulnerable women who have nowhere else to turn for essential care. And this is also about respecting women's constitutionally protected right to make our own reproductive choices. We must not allow Congress to strip away federal investments in family planning clinics by allowing states to discriminate against providers like Planned Parenthood. I urge our Republican colleagues, don't bring SJ Res 13 to the floor. And if it does come to the floor, I certainly intend to join in the fight that Senator Murray, my colleague Senator Blumenthal, and so many others of us, Democrat and I believe Republican, will take to defeat this legislation. Thank you. I yield the floor.